Okay. And yeah, we're recording. And I would, a small request from my side that please, attendees, please keep yourself on mute. Unfortunately, I'm unable to put this on a webinar, so it's on a meeting, point of view. So if it would be lovely, it would be great if everyone, is on mute and their videos are off. I have tried, like I've kept everyone on mute and the videos off, but it would be great if you also cooperate from your side. So yeah, that is a small disclaimer, and we could start with the presentation from here on. It's all about bowel nosodes, and I'm very excited. I've got my books ready, my pen and paper ready, so that I could also sit and enjoy the webinar. So yeah, that's what the introduction. Yeah, over to you.
Wonderful. Well, thank you so much for having us. And we're always pleased to be presenting to you and to all of our guests. My name is Harula, and this is Beth Landau Halpern, and we are part of the team at the Ontario College of Homeopathic Medicine. Today, we'll be talking about bowel nosodes and their use in homeopathic practice, how they were discovered, and bacteriology. So let us begin with the discussion of bacteria. Let me just move this, please, one moment. Wonderful. I'm not able to see my screen, so let's just make sure that we are. Is everything okay there, Beth? Can you see that? Yes? Okay, great. So bacteria, let's talk a little bit about bacteria and the history of bacteriology. Now, the term bacteria came to be in the early days of 1828 when the German naturalist Christian Gottfried Ehrenberg coined the term bacteria, and it comes from the Greek, which means small staff or small rod or small stick. It um, so the name basically is descriptive of the morphology of this tiny biological cell, and it was first observed as a non-sporing formed shape or a rod. Now, the intestinal flora is highly complicated. We know that there are implications where immunity is concerned. So this idea of intestinal flora and bacteriology is on the forefront of many scientific cutting edge technology these days and ideas, because there are so many different types of bacteria and species of bacteria that live in our guts. And of those 500 to 1,000 distinct species, we have only discovered 27%. So there is a huge number of bacteria that have not been discovered and are waiting for research to catch up. Now, bacteria are incredibly important in our immunity and in the way we live, because our life, not only our life, but much life on Earth depends on bacteria for survival. A very easy example is that the bacteria has genes that help in digestive processes and with metabolic processes. One example is the fact that it helps break down or process vitamin B12, which is essential for life. And so the diversity and the composition of our gut is made up of all of these bacteria that play a beneficial role. Now, in terms of homeopathy, we know that life is a balance, and this um, concept of disease, as Hahnemann taught us, really the underlying sentiment is that a vital force would be disturbed, and we then go into a diseased state. However, there's something to be said about morbific influences and individual susceptibility. So we're talking about these concepts that predated medical microbiology, and Hahnemann was one of the first to predict that a contributing cause of infectious disease would be found in a living organism, and he called it too small to be seen with the naked eye. So, one example during Hahnemann's time is cholera, which he described as a brood of excessively minute, invisible living creatures. We understand that as homeopaths, a very important factor, one that is responsible for the maintenance of our health and therefore also disease, remains in our unique susceptibility. However, there is a clear association of bacteria and microorganisms with diseased states. What does that mean? We'll just get into that in a little bit, but let's go back to bacteria and talk about how it was first observed. So this Dutch microscopist who used his own design of a very basic single lens microscope was the first individual to observe bacteria in 1676. And it took another 100 years for someone else to identify bacteria under a microscope after that. Now, Louis Pasteur, was an early advocate for germ theory, also discussed the growth of microorganisms and the fermentation process. And what was interesting about Louis Pasteur was that he identified that this growth was not a spontaneous process. And he also concluded that our stool was, in fact, the source of autointoxication or intestinal toxemia, which after many, many years, that concept was still one that was heavily regarded. So the founder or the father of bacteriology is Ferdinand Kohn of 1870. He was the first person to classify bacteria based on the way they looked. So we know that there are many different types of bacteria. We know that they play different roles and have different functions in our body. And we understand that some are beneficial and others are pathogenic. So what is it? What is it about the pathogenicity, and when does a beneficial bacteria turn pathogenic? This is something that we're going to consider next. So, for example, the typhoid bacterium Salmonella typhi was isolated from the intestines of those suffering from that disease. And those particular bacteria were gram-negative rods that lacked the ability to ferment lactose. Following that, 72 other pathogens, including the agents responsible for bacillary dysentery and paratyphoid and bacterial food poisoning, were also identified. And those two were gram-negative rod-shaped bacteria that lacked the ability to ferment lactose. So during the investigation of this intestinal microbiology, the scientists did see, the researchers saw that there was little or no pathology that could be attributed to these large, huge number of bacteria that were found in the flora of our gut. Something like E. coli was found in the large bowel of nearly everyone. And it's known that up to 99% of the normal enteric flora consists of strictly anaerobic bacteroids and lactobacilli. Large groups of organisms were over years isolated that resembled pathogen-like bacteria. They were gram-negative rods that did not ferment lactose. They were identified by their fermentation reactions in various sugars other than lactose. And since these non-lactose fermenting organisms had rarely been shown to be associated with intestinal pathology, they were usually dismissed as benign residents of the lower bowel. So what happens? What happens that turns seemingly benign bacteria into pathogenic bacteria, and therefore could cause chronic disease? In comes Dr. Bach. He makes a connection that is revolutionary at the time, and probably even now. He was a British bacteriologist, and we all know him as the individual who came up with the Bach flower remedies, but this was his research first. He observed abnormal populations of bacteria in the fecal samples of hospitalized patients, and what he understood was that if he isolated those pathogenic bacteria, he could reintroduce them into his patients in the form of vaccines, and it would effectively cure them of their problems. So he saw intestinal toxemia as a cause of chronic disease. He was looking for these intestinal poisons, and this is how bowel nosodes came into being. Now, he worked with other individuals like Wheeler, Dishington, and namely John Patterson and his wife Elizabeth. So Dr. Bach, along with these other scientists, came up with 11 bowel nosodes, and Dr. Patterson and Elizabeth Patterson, they continued the work of Dr. Bach after he identified these nosodes. Now, how do we maintain this balance of beneficial bacteria in our intestinal flora? Well, our modern lifestyle doesn't necessarily contribute to this balance that we so seek. Any sort of change that it affects the surrounding tissue, the mucosa, will in fact upset the balance of the bowel flora. It will affect the balance or a change of the habitat and the biochemistry of the intestinal flora. And previously benign bacteria could in fact become pathogenic. The GI tract plays a considerable role in immunity, and the disturbance of this flora means it does mean the difference between health and disease. So this healthy balance of bacteria is necessary to ensure proper immune function. Now, these identified bowel nosodes are prepared from non-lactose fermenting bacteria, and we have seen that there's a close connection to chronic disease and their cure. These germs are present in both healthy and people who are suffering from chronic disease. But in those people who are suffering from chronic disease, these bacteria were present in larger numbers, and therefore they become pathogenic. So Bach isolated bacilli from his patients who were sick. He gave these isolates back to the patients in the form of a vaccine. They were prepared from the cultures of deceased organisms, and 95% of the individuals showed a favorable response to this treatment. He later administered a potentized vaccination that was homeopathically prepared, and he also saw positive results. This is why we're talking about bowel nosodes in homeopathy today. And the first homeopathic proving of dysentery Co. by Dishington was completed in 1929. And following that, Bach derived the clinical indications for the bowel nosodes and went off to study the Bach flower remedies. Following Bach's contributions to the bowel nosodes, John Patterson and his wife Elizabeth continued the research and refined the indications for the bowel nosodes used. There was 20 years worth of research. They looked at 20,000 stool samples, and where there was balance, they understood that where there was balance of the intestinal flora, there was no disease. It simply meant that the bacteria was non-pathogenic. The balance of the bowel flora is disturbed by disease, as is the habitat and the biochemistry, which then perpetuates this pathogenicity. This disease condition originates in the host and compels the bacteria to modify in order to survive. So we have to consider this very intricate balance of what health and disease actually mean. And we are all trying to live in this symbiotic sort of relationship between how we interact with ourselves, how we interact with our environment, and then of course the environment within us, how that too interacts with its host that we are. Our lifestyle, the food that we put into our bodies, the stressors that we are affected by, as well as any sort of medication, does affect the flora in a very specific way. So is it that germs cause disease, or is the disease a result of the action of the vital force, which characterizes all living cells in their resistance? So it's an interesting idea. I think that we have to strike a balance, and Beth is now going to discuss the key indications for the use of our bowel nosodes.
Thank you, Harula. That was great. So yeah, I want to talk a little bit about the bowel nosodes. I think they're an incredibly interesting, incredibly useful set of remedies. And certainly I found that there were cases of mine that were so seriously stuck until I learned how to use bowel nosodes, and made it, these remedies made a really big difference for me. So the indications that a bowel nosode may be required is one, the etiology, so that the cause of the chronic disease or the chronic disorder is infection, the use of antibiotics or other drugs, or both. The never been well since, so acquired blocks to cure. So never been well since some medication, some disorder, some scenario. And those will be described in more detail as we talk specifically about the remedies. Systemic corollaries, so prominent generals, meaning general symptoms, meaning large scale signs of fatigue, of toxicity, debility, vulnerability to infection. So almost like this idea of like a breakdown of the whole system. Self-perpetuating illness states that are almost seem to have a life of their own. Evidence of altered surface immunity, so inflammatory conditions of the skin, of the mucous membranes, or internally. Systems referable to the gastrointestinal tract or body orifices. There is almost always going to be some indication of gastrointestinal symptoms in a case that requires bowel nosodes, but those symptoms do not need to dominate. The failure to respond to well-chosen remedies or seeming blocks to cure is a good indicator for really any nosode remedy, and bowel nosodes should often be used. I find personally that there are times when I'll look at a case, I know there's a block to cure. I've been giving really well indicated remedies. We're not getting the kind of results I want. I know a nosode is required, but I'm not finding either results or an appropriate larger nosode, and I will then go to a bowel nosode. And then finally, if you have a patient for whom you are doing stool sampling, and there is bacteriological evidence in the stool culture of significantly increased populations of non-lactose fermenting bacteria or Enterobacteriae, then that is another indication of the bowel of using a bowel nosode, a need to use bowel nosodes. So I'm going to go through the 10 bowel nosodes, and there are at this point just 10 bowel nosodes. I'm of this firm belief that there must be many, many more bowel nosodes that have yet to be discovered or used. But for now, we have 10 really good remedies that we use. There are others less known, and I'm sure there are others beyond that that still need to be discovered. But today we'll be concentrating on just the 10 primary bowel nosodes. So the first one I want to discuss is Bacillus number 7. Some of these remedies are from, we call it Patterson to distinguish it from other Bacillus remedies. In all of these cases, I'll give you a little bit of information about the types of patients who are predisposed to this remedy type, a little bit about the etiology, about the types of disturbances you would expect to find, where you expect the pathology to be, and a little bit about the GI pathophysiology, and then a little more detailed information about the remedies. You really do need to get a good book on the bowel nosodes. Patterson's writing is available, I believe, for free on the internet, you are very unlikely to fall upon a bowel nosode through repertorization. So you really do need to get there through observation of the causative factors that I just discussed, and then research on the individual remedies. So the predisposed types to bacillus number 7 tend to be tense and overworked. The causative factor, the etiology for their disease is, again, is overwork, overindulgence, also drugs and antibiotics. That will be true for almost all of these bowel nosodes. The primary disturbances are extreme fatigue, inflammatory arthritis, chronic fatigue. This is the kind of, this is a great remedy for chronic fatigue, that a pervasive systemic fatigue. The GI pathophysiology for bacillus number 7 is diffuse. It can have an IBS, and that's irritable bowel syndrome picture, but not necessarily so, a bit hard to identify. The mind picture in bacillus number 7 is somebody who's driven, domineering, acquisitive, eager to succeed, high level of rigidity physically and mentally. They often push themselves beyond reasonable limits. There's often a lot of neck and back pathology with cracking joints, stiffness, swollen joints, loss of muscle tone. There's also a strong thyroid affinity with this remedy. This is a great remedy for adults who develop allergies late in life. And it's a bowel nosode that's rarely indicated in children's cases. You can see in this remedy description, as well as all the ones that we're going to talk about. I'm sure when I started talking, you start seeing nux vomica right away. You start seeing bryonia, perhaps, other remedies that look like this picture. And you've given nux, and you've given bryonia, and you've given other well-indicated remedies, maybe calicarbonicum or something for in the bacillus number 7 instance, and you're not getting the results you need. And when the picture of the remedy matches up, and the more structural things that I've discussed at the beginning of this remedy, sort of the etiology and the predisposed types, that's when it's a great idea to try a bowel nosode. The next remedy we're going to discuss is bacillus number 10. The predisposed types for this remedy are dominantly female. They're insecure. They have a desperate need to be accepted. The etiology tends to be sexually transmitted diseases and other opportunistic infections. There's an overuse of supplements, of herbals, and of homeopathy. Homeopathy, if abused and overused, can cause issues, systemic issues in a person. I'm often concerned by people who go and get the polypharmacy remedies that are available over the counter. And each of those remedies contains within it 8 or 10 individual remedies, and people take multiples of these. And I've had people coming into my practice, they're taking, 4 or 5 of these different combination remedies, which means they're taking up to 50 different remedies at the same time. And that can cause a lot of systemic confusion on the part of the body that can then indicate the use of a bowel nosode. The disturbances you're likely to see in bacillus number 10 are inflammation of the mucous membranes and systemic toxicity. The principal locations are the vagina, the mouth, and the urogenital organs. And the GI pathophysiology is disturbed bowel habits, and again, vague IBS pains. There's not a lot of very clear GIT pathophysiology in either of these bacillus remedies. The mind symptoms for bacillus number 10 is a lot of frenetic social activity. There's pressure to live up to images of beauty, of sexual attraction, of status. These are people who use an overuse of a range of products and procedures to attain this goal. So these are people who are using products of questionable safety and validity and using a lot of them. I think immediately of women who are using vaginal cleansing products that strip the whole urogenital and certainly the whole vaginal area of any kind of beneficial bacteria. They're doing this to live up to a certain idea of how they should look and they should smell and how to make themselves attractive. But at the same time, they're causing themselves some fairly serious chronic health disorders. Other mind symptoms include irritability and depression and anorexia. The genital picture, there is this offensive, fishy odor from chronic vaginitis with greenish corrosive leukorrhea. So there you've set up again with these kind of vaginal cleansing products that I mentioned previously, this vicious cycle of people feeling that they have this offensive discharge, they need to clean themselves out more, and they create a worse problem for themselves because they've created this state of chronic bacterial imbalance, which becomes deeply, deeply pathological. I used these kinds of cleansing products as an example, but you can imagine, if you stop and think about it for a bit, some of the other cleansing products and beauty procedures that are out there for people, and the type of person who feels that it's necessary to indulge in those, and the problems that ensue. Other important symptoms to indicate bacillus number 10 are stress headaches, pelvic inflammatory disease, and spongy gums with halitosis or bad breath. The next remedy I want to talk about is dysentery co, which I like to call disco. Disco is the predisposed types for disco are trim, they're health conscious, they're anxious, tense. Again, it's a remedy more commonly seen in women than in men. The etiology are drugs, antibiotics, and other overtreated infections. And Tylenol is a real problem for people who have excess dysentery co-bacteria in their GI tract. There are people who respond very poorly to Tylenol, and Tylenol makes this imbalance much worse. The primary disturbances you'll see in patients requiring this remedy are endocrine, they're thermoregulatory, there's a lot of immune hypersensitivity and chronic fatigue, once again, just like we discussed in bacillus number 7. The principal locations in which the pathology shows up is in the thyroid, the mucous membrane, respiratory tract, and cardiovascular system. And the GI pathophysiology is located largely in the pyloric area, in the sphincters, in the duodenum. There's a lot of indigestion, diarrhea, irritable bowel syndrome, and Crohn's disease. The mind picture of dysentery co is that they're over anxious, they're overwrought, they're self-doubting, they're never good enough, they have great fear of failure, they're obsessive, fastidious, fearful around health issues. And stress is a vital trigger for these patients. They're not able to sleep and due to an inability to relax. And these are patients whose mental states somatize to the bowel. Other important indications of disco are acne and very driven teens who are not satisfied with themselves. It's a very sort of superficial sort of immunological response. Cortisol and adrenal rushes that cause or exacerbate IBS symptoms, and pyloric stenosis with projectile vomiting in children are some of the particular symptoms for disco. As with all of these remedies here and all the remedies we ever discuss on any of these webinars, we're only able to go into a small amount of detail, and you will, with a good bowel nosode repertory, be able to find much more detailed information. And I am not going into the details of every sort of physical symptom that you might see, it might be indicated by these remedy pictures, just giving you overall picture, in particular keynotes and characteristic symptoms. Moving on to Faecalis. So Faecalis is not a well-known remedy, not one I've used a lot, to be honest. The predisposed types for this are stress due to the inability to communicate. There are very specific circumstances for which this remedy is used, and I'm not sure I've ever seen a patient in my clinic who called for it. Faecalis is very well indicated in patients with a history of institutionalization. So these are people who have lived in homes due to developmental, physical disability, chronic disease, incarceration, issues that have made them live in situations in which they are being fed institutional food, and their individual needs and desires are not taken into account, and they're deeply suppressed. There's very little opportunity for them to speak up for themselves. So the etiology is an overexposure to hospital environments, artificial feeds and poor diet, birth trauma, and chemo and radiation. There is the disturbances you'd expect to see, post-op diarrhea and constipation, abdominal distension. The principal locations are large bowel, lymphatics, skin, urinary tract, and the GI pathophysiology is alternating stool with a strong emphasis on stubborn and intractable constipation. The mind picture for Faecalis is that the emotions are alive, but communication is suppressed, often developmental and social delays. This can be violence in the mental picture due to communication issues. There's severe irritability and depression, alternation of mental and physical and bowel pathology. And it is a remedy that's indicated in cancer care. And I'll admit that I've never used it in a cancer case, but I can certainly see in a cancer case where there's been a lot of radiation and chemotherapy and perhaps poor diet, that it would be a remedy that would be well indicated. Gertner. This is a wonderful bowel nosode. The predisposed types for Gertner are thin, active, bright. They have overactive minds with undernourished bodies. It's a big, big remedy for children. Etiology is infective, antibiotics or drugs. The disturbances are immune or autoimmune, malabsorption syndromes, and inflammatory arthritis. The principal locations are the small intestine, of course, where absorption occurs, the lymphatics, glands, and spleen. And the GI pathophysiology tends to be diarrhea, bloody stool, and defective absorption once again. The keynotes for this remedy are nutrition, nutrition, and then once again, nutrition. It's often called the child's nosode because it's very, very useful and strongly indicated in nutritional disorders common to children. These are for physically frail but mentally energetic and alive young, slight children, strong milk intolerance. There's constant immunological activity of one sort or another. It's a great remedy for children for whom there is a discharging ear every time they cut a tooth. In the mental emotional picture also includes sleepwalking and night terrors. And then I want to move on to Morgengertner, which is a little bit different from Gertner itself. So Morgengertner, the predisposed types are socially dysfunctional. They're challenged, pale, apprehensive, anxious, often postmenopausal women. The etiology is sedentary habits, poor diet, foodborne bacterial toxins, stress, and drugs. The disturbances are low-grade chronic GIT inflammation. Menopause is a big part of this picture. Immunological disturbances, liver and renal tract disturbances, and the GI pathophysiology is flatulence, distension, and heartburn, this sort of low-grade chronic type of discomfort in those regards. The mind picture for Morgengertner is that they're irritable, tense, nervous, weepy, not whippy, weepy. They fear crowds. The excitement does not do them well. They're worse in company. They're very particular people. The stomach symptoms are strong in this remedy. There's flatulent distension with fermenting gas throughout the gastrointestinal tract that descends into the colon. They have this feeling that they want to stick a pin into their gut to relieve the distension from the gas. Other important keynote and characteristic symptoms are the aggravation from alcohol, the intolerance of fruit, which becomes gas in the gastrointestinal tract right away. Food-induced migraines with gas and distension, renal stone formation, and Tylenol does not agree with these patients either. It fills their gastrointestinal tract with breakdown products, which again is translated as either eructations and water brash or flatulence. Okay, Morgenpura. So Morgenpura is the predisposed types are they're heavy, they're plethoric, sluggish, florid types. The etiology is chronically poor diet, drugs, steroids, alcohol. Weaning and introducing solids too early can set up a Morgenpura state. The disturbance is metabolic and circulatory, and the disturbance is often seen on the skin as well. The GI pathophysiology is constipation, hemorrhoids, often from constipation and urging, and diverticular disease. The mind symptoms in Morgenpura are that they're introspective, weepy, apprehensive. The skin symptoms, eczemas that occur at the time of weaning, particularly if the weaning is happening early, in skin eruptions with itching is an indication for this remedy. And then other, I want to jump over to the mucous membranes and we'll go back to other mucous membranes. It's sort of a lot of catarrhal profuse catarrhal production in the ear, nose, throat, and bronchial tracts. There's postnasal catarrh, sinus infections, dry mucous membranes, a lot of histamine production with sneezing and allergy reactions, smelly discharges, annual pneumonias, and chronic bronchitis are all indicators for this remedy. And I want to mention that patients, this is a remedy that's indicated for patients with a strong sulfite sensitivity. Sulfites in any form create diffuse illness with bloating, weakness, food intolerances, and bad breath. So Morgan Co is a remedy that again doesn't have a highly defined picture. It is a combination of Morgan Gertner and Morgan Pure. It has, or the picture is one of a combination of Morgan Gertner and Morgan Pure. It has both skin and bowel symptoms and fungal skin infections. There's a diffuse unwellness with skin symptoms and itching. Patients who have no diagnosis, but just this general state of being unwell, they have had a life of poor diet and junk food. If Morgan Gertner was indicated and didn't work, and Morgan Pure was indicated and didn't work, you might want to try Morgan Co. Mutabile. So Mutabile is for the predisposed types for this remedy are unstable, changeable, capricious people. The etiology is emotional stress. Again, herbal medications and overtreatment with symptomatic drugs, poorly prescribed homeopathic remedies. We discussed this a little bit previously, and abuse of laxatives. You can imagine that laxatives and overuse of laxatives can strip the gut of beneficial bacteria, setting up an environment in which there will be a regrowth of bacteria that will be out of a sort of beneficial balance. Laxative abuse is a common way for young people who have weight issues or have perceived weight issues, also known as body dysmorphia, to sort of purge themselves. It really is a form of bulimia, and it's actually quite common because laxatives are available, readily available over the counter, and a lot of people feel that this overuse of laxatives will help keep their weight down, keep food running through them without it becoming sort of a weight on their bone structure. And of course, in the long run, it creates more problems than it could ever solve. The disturbances that call for mutabile, can you go back one? Thanks. The disturbances that call for mutabile are mood swings, UTIs, urinary tract infections, recurring urinary tract infections, asthma, eczema, and excessive perspiration. And the GI pathophysiology can be diverse, but it's often diverticular disease. The keynotes for this remedy are alternating states. There's one condition that alternates with another. The mind picture, there's tearful, weepy, I keep saying whippy, tearful, weepy, desires company. There are back symptoms in this remedy commonly, especially in the lumbar region, worse sitting, better sitting, worse standing. There is this tendency, we see in some of the other, well, in many of the other bowel nosodes, to overtreat themselves. The alternating states are such as anxiety, so this hyper anxious state alternating with underfunctioning, and then skin eruptions alternating with respiratory symptoms. Next. Proteus. Okay, Proteus, the predisposed types for Proteus are angry, they're unstable, they're high strung, they're easily aroused, hysterical, unwilling to accept changes. The etiology for the use of Proteus is unremitting stress, antibiotics, and surgery. The disturbances are psychoneuroendocrine disturbances, degenerative condition, fibrositis at the sites of chronic musculoskeletal tension. The locations are autonomically innervated systems, central nervous system, the musculoskeletal system, cardiac, head, circulatory system, and the GI pathophysiology or duodenal ulcers, which we certainly understand is closely connected to high-strung, easily aroused hysterical types in irritable bowel. The mind picture is the somatization of stress and fear into the gastrointestinal tract. There's also violent explosive outbursts with hysterical emotions. There's a strong head picture in Proteus. There's a frontal headache, a regular frontal headache with feeling of weight, migraines with blurred vision and headaches before menses, and other important keynotes and characteristics of Proteus is that Proteus produces ammonia. So the infections in people needing Proteus smell very strongly. There's a lot of upper GIT, hyperacidity, and reflux. And there's also a histamine producing, it is a histamine producing organism, which creates a lot of itching. All right, the last now bowel nosode we're going to be discussing is psychotico. So the predisposed types for this remedy are overweight, sallow, anemic, puffy with greasy skin. The etiology is infective, especially upper respiratory tract infections and measles, immunizations, antibiotics, drugs, stress, enterovirus infections such as the hand, foot, and mouth disease and Coxsackie infections. The disturbances are on the surface immunity, their catarrhal states, locations, the respiratory mucosae, sinuses, the nasopharynx area, orifices, skin, gastrointestinal tract, and genitals. And the GI pathophysiology is chronic irritation of the entire alimentary tract, meaning starting at the mouth and going all the way down to the anus, distension, children with digestive difficulties after enterovirus infections like the ones listed above. Hand, foot, and mouth disease is a virus that we see an awful lot in the young school child, in the population of young school children. And this is a great remedy for children who have digestive difficulties after having had hand, foot, and mouth disease. The mind picture in psychotico is this nervous irritability. They're in a lot of attention-seeking behaviors, fear of the dark, fear of animals, fear of being alone. Other important indicators are relapsing infections, recurring asthma, recurring sinusitis, recurring upper respiratory tract infections, cyclical infections with antibiotic resistance. This is a big, all of these remedies are great for with antibiotic resistance, psychotico perhaps more so than any of the others, lingering catarrh and fatigue, wheezing with respiratory infections, proliferative infections, and very strongly indicated in cases of staphylococcal infection and MRSA. MRSA, of course, being an antibiotic resistant staphylococcal infection. And so that is a very brief and I fear slightly not entirely satisfactory look at these remedies. I think you can get the feel from what we just said that these are really, really useful remedies. And um, they're great remedies to give a try. But I want to talk a wee bit before we close down and answer some of your questions. And I see there are a few of them waiting for us, about posology, because these are not remedies that you can keep giving and giving and giving and giving and giving, because you have to recognize that in giving these remedies, you are you're interfering with the very delicate bacterial balance of the internal organism. And we don't want to interfere with too much aggression. I generally use 30s and very, very occasionally use a 200 potency. Do not repeat a bowel nosode within 3 months after seeing an initial improvement. Only continue giving remedy in the face of slow improvement, or if there's no improvement and you think maybe a higher potency or a repetition of dose would be a good idea, you can repeat the remedy. But otherwise, after those initial doses, don't keep repeating the remedy. Now, an initial dose does not necessarily mean a single dose. An initial dose may mean, Gertner 30, 3 times a week for 2 weeks, and that's the initial dose. But you don't want to keep doing that once you start seeing an improvement. You usually can see in the stool a shedding of bacteria 10 to 14 days after giving a curative remedy, so that this excessive pathological bacteria starts coming out in the stool. So repeating the bowel nosode during the positive phase of shedding can cause very serious aggravations in your case. If you are not obtaining stool cell cultures, and most homeopaths do not ask for stool cultures from their patients, do not repeat during a period of general amelioration. You're looking for rapid, significant, continuous improvement. And when you have that, you do not repeat the remedy. I think that wraps us up, Harula, and leaves us with just about 3 minutes to answer a handful of questions, if there are any.
Question about books.
I knew there'd be a question about books. So you can find a lot of this stuff on the internet. Patterson's material is almost all available, I believe, for free on the internet. I'm sorry. There's.
I'm so sorry to interrupt. I've already put the link on the chat box where they can.
I will.
No, she did already.
Yeah,
she did already.
That, so that it's easy on you. Yeah.
Thank you. Franz Vermeulen's book on Monera has a lot of the bowel nosodes in it, and that, along with millions of other bacterial type remedies, that is a very good source. Will Taylor has done an excellent course on the bowel nosodes, and I believe that course is available on the Whole Health Now educational site, and you can purchase that course from them. It's a very, very good webinar-based course. And I learned my bowel nosodes from working with Peter Fisher, who sadly is no longer with us, but that was where I learned my bowel nosodes. And I honestly don't know if he's published about that, but it would be something to look up. Agarwal has a book on bowel nosodes that I have in my library, but I haven't found hugely successful. A lot of this is just a collection of information and material from various sources that I've sort of pulled together over the years for clinical use.
Discussion about repeating the doses.
Okay, so I think that I've answered that question. I don't think we need to repeat it. Do you? I'll
Thanks.
repeat once again, very, very briefly. If there's an improvement, do not repeat. If after about 3 months, you feel like you need another dose, go up higher to the higher potency, and you can certainly repeat then. But you do not want to repeat these remedies during the phase of amelioration. And you can dose them as you would most remedies. As I say, I tend to stick to 30s and 200s with these, and maybe will give, depending on the case, I may give a 30 in water 3 times a week, or for morning and night for 2 consecutive days, just depending upon the sort of state and the vitality of the patient, and my confidence in the remedy, and my concern about aggravation. So, the usual posology considerations.
A question about if there was improvement, would you continue dosing constitutional remedy or have another remedy involved during the process? I mean, if there's improvement, you just don't dose.
If there's, these are great remedies. What I would do is, if you're seeing an improvement, and then you still feel you need another remedy, you can go back to the constitutional, and after bowel nosode, like any nosode, you're going to see the constitutional remedy working better if it's indicated. Doing it as a matter of course, I don't ever suggest any homeopathic remedies as a matter of course. But if you're feeling you need another remedy, by all means, go back to the constitutional. If it's still the best indicated remedy, give it after the course of bowel nosodes, and you're likely to see that remedy acting with much more effectiveness.
We have 2 quick questions from our Facebook Live, and Jane and Stephanie have asked about repertories separately for bowel nosodes. Is there a
I think we've discussed that just now. These books just mentioned are repertories.
as well as
Agarwal and Patterson have repertories for them. They're not. You can't use a regular repertory. They're not strongly indicated in most repertories. So you do need to have a bowel nosode repertory. And as I say, Patterson, Agarwal, trying to think who else has one off the top of my head. Those are the 2 that I would go to first.
Indranila has asked about poly bowel nosodes, that is prescribing 2 or 3 bowel nosodes at the same time.
Right. So there is a remedy that I've been using a bit recently, and we've been using in our school clinic in certain cases. It's called Polybowel Nosode Plus. Polybowel Nosode Plus is a remedy that's a combination of all of the bowel nosodes, as well as digestive enzymes, and I think it has candida in there as well. And I've been using that when there is diffuse bowel pathophysiology, and as well as an enormous digestive issues. And I almost use it like a detoxification remedy. So, for instance, a case of extreme celiac disease, in which responded a little bit to Gertner, but then didn't really go anywhere from there. Responds to almost all homeopathics for a short while, then stops. It's not just celiac disease, it's celiac disease with complete systemic toxicity and allergy to just about everything, and have started using the Polybowel Nosode Plus in this case, and getting some really good results. And in this case, what I've been doing is giving, I started with a 30, and like I would with any detox remedy, I give the 2 remedies, so say Monday and Thursday in the first week, and continue doing that until there is no aggravating response, and then go up in potency from there to the 200, repeating that pattern of dosing, and so on, up and up and up from there. I'll probably not go up to the 2M in this case, but I might. We'll see how things go and how the patient is doing. So that is a really good fallback when you've really tried just about everything else. Like any combination remedy, I always prefer to do an individual remedy if possible, because you have more control over the remedy. But if you aren't able to find an individual remedy or get the results from the individual remedy that you want, using something like Bowel Nosode Plus is certainly a possibility. And I would say that yes, absolutely, you could give 2 Bowel Nosodes at the same time if you really felt it was necessary. I don't see any reason why you couldn't do that. I would prefer to give 2 at the same time than to give them sequentially, because you don't want to be dosing when the body is shedding bacteria.
Great. Any other questions, audience, or shall we end the webinar on a high note?
I'm sorry, I can't hear you.
I'm sorry. Can you hear me now? I'm audible.
I can now. Yes, I can.
Great. I'm extremely sorry for all my technical issues.
It's
So
okay.
any other questions, or shall we end the webinar in a high note of learning about polybowel nosodes right now?
Okay. Well, everybody, I
Great.
want to say thank you so much to all of you. We are always so appreciative to Bahola and I Love Homeopathy for hosting us. We really enjoy the audience here and are so happy to be a part of this community. And we thank all of you for joining us. And thanks to Rashmika for hosting us, and wishing you all a happy evening and happy day, depending upon where you are.
Thank you so much. Thank you so much. It's always a pleasure hosting both of you. It's always wonderful, wonderful. We learn a lot, definitely.
Thank you.
And yeah, we're having a webinar next month, mid-March. We shall let you know the topic, the date and time, everything, probably by the first week of March. And please stay tuned for the same. Thank you
That
so
sounds
much.
great.
Yeah,
And please, if anybody has any further questions or wants to connect, you can contact us at the Ontario College of Homeopathic
yeah,
Medicine. We welcome ongoing conversations with homeopaths everywhere.
yeah. The
Okay.
same has been added to the chat so that you can email them as well. Thank you so much. Thank you
Thank
so
you
much for
once
joining.
again, Rashmika.
Have a nice
Okay.
day. Have a
Take
nice
care. Okay. All
evening
right.
wherever you
Okay.
are. Yeah.
Okay.
Bye.
All right.
Bye.
Bye-bye.